Hello, my name is Elijah Aguilar, and I will be providing the presentation for the staff training PowerPoint regarding conflict resolution in ABA settings and other related environments. We'll begin with an overview of the staff training presentation. This training presentation will aim to equip staff members with effective conflict resolution strategies tailored to common issues encountered in ABA clinical settings. By understanding and applying these strategies, staff can enhance collaboration, improve client outcomes, and foster a positive work environment. As we all know, conflicts are inevitable in clinical practice but can be managed constructively. Proper resolution minimizes disruptions, promotes team cohesion, and ensures consistent client-centered care. We'll also be discussing a few real-world examples, giving opportunities for staff members to communicate with one another about real-life examples that you faced and how you've worked through these difficult situations and what you've learned. Now, here we have some learning objectives that by the end of the training, the staff will be able to identify common types of conflicts that occur in the ABA clinical settings, apply specific conflict resolution strategies tailored to each conflict type, recognize preventative measures to reduce the likelihood of conflicts, and demonstrate effective communication and collaboration techniques during conflicts. Now we'll go through a breakdown of the overall presentation and the topics discussed in it. We'll be going through an overview of why conflicts happen. Some examples may be differing opinions, progress issues, miscommunication. We'll discuss the impact of unresolved conflicts on clients and staff, solutions to resolve conflict, and preventative measures to work through potential conflicts. Alright, we'll have our first conflict type along with its strategies be over the topic of staff disagreements. Staff disagreements may happen over intervention approaches, schedules, and/or responsibilities. Examples of this may be when there is confusion over client programs where staff members are implementing programs two different ways, recording negative when it should be positive, and vice versa. Now, some resolution strategies may include mediated meetings, active listening, focus on client goals, develop collaborative plans. So when we have these meetings, we'll be meeting with our BCBAs and both staff members, or perhaps more than two. There are some clients that have 3 or 4 staff members, where we can communicate through one another in a passive, calm manner, discussing and clarifying through client programs or any other goals or questions. Some preventative measures would be regular team meetings, clear communication protocols, and conflict management training. Again, in our clear communication protocols, this may go into our client programs. BCBAs, when we are writing our programs, we will always want to make sure we are clear and objective to avoid any miscommunications. As far as staff members go about clarifying programs, we want to make sure that we're asking our BCBAs rather than the other staff member working with the client, as this may lead to further confusion, and it is very possible that we'll have 2 staff members or multiple implementing the program completely wrong due to one staff member explaining it poorly to another. So we always want to make sure that we're communicating properly and with the proper supervisor. Our next topic will be over issues with client progress. This is due to frustration over progress rates or methods. This goes somewhat hand in hand when there is miscommunication between staff members or supervisors, where we may have one staff member recording client data as positively and the other running it negatively. And we would need to, as our resolution strategies indicate, we want to review our data. We want to make sure that we are writing our data to be objective, and we want to go through joint intervention adjustments and routine monitoring. So, of course, when supervisors, we are observing our clients, we want to make sure that we have a over 80% IOA, that we are finding our staff members to be recording properly, accurately, and precisely among all programs. Now, in our preventative measures, we want to make sure we're making, once again, clear progress, expectations, writing in those program notes, how we want to implement programs and how to record, and in what level gesture prompts, if we're using that in a specific scenario. We want to make sure we're recording in a correct manner, whether that be full physical or partial physical. And we want to make sure we're regularly observing and supervising properly through at least 5% of the month. Our next conflict type would be family provider misunderstandings. Now, this occurs through miscommunication about treatment goals or procedures or overall clinical experience when working with our clients and communicating with our family or caretakers. Resolution strategies would be family clinician meetings. I know that not all RBTs or RBTs will be participating in family meetings, depending what route you want to take in this career. But if you are participating in any family meetings, you want to make sure you're actively listening. We're writing our clear written communication notes. If we're writing notes home, do parents want the note home? If we are we writing enough information for them to know how their kiddo's doing at the end of the day? And we want to collaborate and plan any modifications if necessary. We would discuss this when we're having those family meetings with the supervisor there, and all three or more than that would be discussing any modifications for plans or expectations when discussing all opinions and reviewing data. Moving on to our preventative measures, we want to make sure that we have a clear understanding over our family orientation. We're regularly going through updates, again, on those take-home notes, or are we going through emails with our family members or providers? We want to make sure we're always going through a staff training, communication, and cultural competence. We want to make sure that we are well read and respectful about our clients' culture, traditions, or other holidays as well. Next up, we'll talk about some common challenges and solutions. Our first one will be handling emotional reactions. Now, working through our days, it can be difficult at times, working through tantrums or other maladaptive behaviors. We want to make sure that we're asking for our breaks, getting our water, using the bathroom. Nothing ever wrong with taking a break, just to breathe or at least to communicate with a supervisor how you're feeling. We are working in the field of understanding our feelings, and we want to be respectful of our staff members as well. You deserve your breaks too. Moving on, maintaining professionalism. Of course, we're not going to be yelling profanities to our clients or anywhere nearby in the area. So once again, make sure, take those deep breaths, take a breath, get some water, whatever you need. And most of all, important of all, we're going to be making sure that we are ensuring client welfare remains the focus. As difficult as they may be, we want to make sure our kiddo is happy, safe, and sound. If any assistance is ever needed, remember to communicate with peers nearby or seek guidance from a supervisor. For our next slide, we'll be talking about best practices to use when facing conflict in the ABA clinic. We want to make sure that we're actively listening, using empathy in our communication, that we're talking in a nice, calm tone with one another. We want to make sure that we can truly understand each other, taking pauses in between any heated discussions if it gets to that point. We want to make sure that we're focusing on shared goals. We want to, of course, keep priority for our client well-being, making sure that we're reaching goals in a successful manner, changing anything if needed. We want to make sure that our documents are accurate. We don't want anything getting conflicted. And if anything is incorrect and accurate as far as documentation goes, we want to make sure that we fix those errors. Sometimes sessions get mixed up in the calendars. Maybe some of you use Rethink, and some of those times need to be changed at the end of the day. We want to make sure that we are open and respectful towards one another. There's a lot of people working within our field, all of many backgrounds and cultures. So it's important to be open, respectful, mind our manners, and we can learn many things from our peers. And we want to regularly revisit and update communication protocols. At times things change, new phone numbers or new goals are changed. We want to make sure that we're looking through our BIPs if anything has changed through that. Making sure that we are staying ahead, as I like to come into the office as well, 15 minutes before we open up, always making sure that you are prepared for your day. Okay, here we'll have a opportunity to discuss among our peers, where we have some questions where you can pause the video here and talk among yourselves and how you face these conflicts and what you've done to resolve them and what happened. Explain yourself. How'd you feel? How did the people involved make you feel? And here, as we come to the conclusion of our presentation, we have some additional materials ready to be handed out at the end of the PowerPoint. In the first one, we have a summary over our points that we can discuss in the first link, and we also have a conflict resolution table that can be viewed. In the next slide, we also have a snippet at that table where I'll discuss a little bit more. Here we have our final handout, which is the conflict resolution table constructed by myself, where it'll list some conflict types that we discussed, along with the descriptions, resolution, and preventative measures that we've also discussed. There's a few other notes in there as well that you can discuss among yourselves, review, make sure maybe keep a hand on yourself in your locker or folder or backpack. And that'll be all for our presentation. I've hoped you learned a few things about the conflict resolution and how you can better communicate with your peer members, family members related to ABA services.